The next presentation, Life Goes On, in the state of Illinois, presented by Jan Grimes and Sally Selke.
Kathy Selke.
Kathy Selke.
Good afternoon, and thank you for giving us this opportunity. I'm Kathy Selke. I was the senior staff member in the Secretary of State's office during the initiation of the Life Goes On program, and I am now its Chicago coordinator. It is an honor to be here today representing a program that has made a critical difference in the lives of thousands of people. It is the first state effort to dedicate public funds to a driver's license department for an organ donor awareness campaign and to register the public as potential organ donors in the actual driver's license facilities. As stated by the head of the Regional Organ Bank of Illinois, who is Illinois' organ procurement organization designated by the federal government, what makes this program particularly innovative is the ongoing commitment of funds and the backing of a constitutional officer who has mobilized the bureaucracy to make this issue a priority. Life Goes On doesn't just allow the opportunity to sign the back of a driver's license. We educate the public first, then we give the people that come into the facility the opportunity to register as an organ donor, then we follow up to make sure that the family knows of that person's decision, and then we have joined partnerships with the medical community to try to close that loop so that the question is asked and that teams are prepared in hospitals to then ask the question. Because of this program, the Illinois Organ Bank broke national records for organ donation for the past 2 years, increasing about 20% each year after it had been years of being flat with no increase. This means about 550 additional lives were saved. Our registry is the largest in the nation, with more than 3 million people signed up to be organ donors. We are widely recognized as the premier state for organ donation and public awareness. We've heard from people in 24 states wanting to know how they can get such a great public response. Concerning the process, you need to know that the Secretary of State has actually added a new office and mission and is holding the staff accountable for that, as well as organizing a group of professionals in the area to advise him on this program. We are also being asked to continually evaluate and improve the program. Here's an example. We have very long lines at a lot of the metro facilities, as you can imagine, but we are making our facilities stronger points of sale for organ donation without slowing down the service, which is a very important point. Now, while people wait in line, they see a video. At the counter, they see a local story. Their renewal notice even reminds them about organ donation, so some come in asking, where do I sign up? These are the program elements we think are the most innovative and replicable. First is our legislation and funding mechanism. Second is our 24-hour registry. Third is paying for commercial time. And fourth is targeting audiences, including minorities and medical professionals. Jan Grimes will expand.
On that first point, Secretary of State Ryan initiated legislation and identified a way of collecting $2 million annually for this education program through a vehicle services fee. That's an approach that could have backfired on him politically. Fortunately, it drew public response and positive media attention, and we've gone on to help Missouri and South Carolina pass similar measures, although their money is voluntary. 5 other states have also borrowed parts of our program. Concerning that registry, what's unique is that it uses the existing database at no additional public expense. It's available to organ banks 24 hours a day to help make that decision at the hospital, and that's a vital feature few states understand or have emulated. The key issue, again, is that the registry helps people make decisions at the facility, not at a trauma scene when they're in a state of shock and denial. The registry, for us, also gives us a way to find out what segments of the public and what facilities are not on board so we can increase public awareness, training, and grassroots work. And that computerized system, it spits out automatic letters that go to families with this idea of reminding your family that you did this at your facility. 32 other states have databases that could be used as registries. They have a way to enter information about donation, but only 5 are even approaching what Illinois has done. Concerning our commercials, we decided to buy commercial time despite the fact that the National Coalition on Organ Donation and other agencies discouraged us. The prevailing thought was if you buy time, you won't get free time. But our paid campaign has been so effective that other state agencies are using us as proof of the benefit of buying time, and the National Coalition changed its policy. A novel point here is that we've used private sector marketing techniques for this government initiative. And finally, targeting minorities. That's vital because there's a greater need for organ transplants, and people benefit when organs come from someone within the same race. For kidney donations, the #1 need. And we're sharing that message with minorities that this is important within your community. For physicians and trauma doctors, we've commissioned a curriculum and offer conferences. We've built a partnership with the Illinois Hospital Association to provide training so that the question is asked and the incidences are better identified at hospitals. And we're sharing these materials for doctors and for minorities with other states. In closing, the availability of organ transplants is an innovation in itself, spurred by the recent availability of anti-rejection drugs. The waiting list for organs is now at a crisis point nationally. Last year was a banner year with 20,000 Americans receiving organ transplants, but 47,000 are still waiting. The Illinois program is providing innovative solutions, it's being duplicated by other states, and it's demonstrating that government can make a vital difference in people's lives. Thank you.
Thank you. Let's begin with Dick, followed by Dot.
I think the strength of the program is the way it's marketed. And I would be curious to know two things. One, how many actual organ donors have come forth as a consequence of the program, if you know that. And secondly, how the Secretary of State is the point person in these. How have you withstood the political fallout from that?
Sure. I'll take the first one. Yes, we're hearing anecdotally almost daily from the Organ Bank that people are mentioning our commercials, and specifically we use an African American child in one of them, and even children are saying to their parents, I know that this is an issue within the community and people like that little girl are benefiting, and it's especially important that we're hearing within the minority community. We've also gotten many letters from families who said, I knew about this from your commercials. We had White Sox Park, we had Organ Donor Night, and many people were there to tell us also.
But do you know, do you have numbers in terms of the increase or the rate of increase related directly to the program?
Yes. For 3 years, the numbers of donations were flat. The first year our program came out, there was an 18% increase in donations. The next year, a 20%. Our minority donation rate, I don't know where it started, but I know that we're now at 30% of our donors are African Americans, and that's outstanding.
If I could just add to that a little, we do track, after we have a commercial set, maybe a week time, the numbers went up dramatically after that. I mean, so we do track that, plus the regional organ donor banks tell us of these instances, and that's really all we have to go by.
Can I be specific on that? Over time, about 1/3 of a percentage point every month, our registration goes up. This is registration that we can track, not donation, which is actually quite rare. Within 8 weeks of showing a commercial, we get an average of a 2% jump. Then it sort of wavers, going up slowly, showing the commercials about 2% within 8 weeks.
Next question from Dot.
Clarify something, or you clarify something for me if you would. I stop in to renew my driver's license and I register as an organ donor. But then you contact my family. That's what I'm not sure the connection about how you do that. And then also I'm interested in how you work with the medical community so that when that time comes, they would work with my family. I don't understand how that works.
Well, basically, you've signed up to be an organ donor.
Yes.
You're not going to be the person they're asking in the hospital.
Right.
They're going to be asking your family. No, it's confusing because you're the one that's asking.
Yes.
So generally, we follow up with a letter that says, you've signed up to be in the registry. We applaud your decision. It's wonderful. You're saving lives. But you have to make sure your family knows
Or you
this.
write the letter to me and ask me to talk to my family.
At the same time, the second phase of our marketing campaign, instead of just stressing general awareness, we'll stress now, be a donor, tell your family. That's also part of the message.
Okay, and you're working with the medical community, though, to be more aware of the need to work with the family right away?
Twofold, we're working with the medical community. The first part is we are trying to help the organ procurement organizations showcase the best practices, the hospitals that put together good teams to approach the family. The second is to make physicians aware that if they're that people are becoming more aware. It's their responsibility also to be talking to people about being organ donors and sharing their decisions with the family so that the medical professionals in the trauma units are more comfortable approaching family at the time of a trauma.
Okay.
And again, the
Dave?
unique aspect of our registry being that you can call 24 hours a day. I've got a potential case here. You can let the medical community know 40% of the time, hopefully, that person actually wanted to be a donor. It takes a lot of guts to approach families at this time. There are plenty of medical people who just, knowing all they know about the life-saving measures, walk away from this one, folks. So to
David?
know that many families are on board, and in this case, the person wants it, often that's enough. And we've had organ banks tell us your number, knowing that they signed up. They're often not with their driver's license, it's someplace else, and hours and minutes are at stake here.
David?
This may be a little off point, but there's a good deal of publicity that doctors are not paying much attention to living wills. When they get them, they just sort of, and people are told if you want a living will, you ought to go see an attorney, give someone the power of attorney. Is that problem cropping up with what you're doing?
We have been approached by some people to help them with that. It's not really part of this, so I would suggest that we're not going to be involved in that. But I think it's way off my subject matter, but I think it's the same thing, yes. And we have to find ways to deal with that issue.
Thank you both for